My biggest challenge has been related to communicating with all the different teams that are involved in helping deploy the AI algorithm within your clinical setting. So I've learnt a lot, and I've met lots of new people that I didn't know existed, because previously I didn't need to converse with them or need them for anything. So I've learnt I've developed a new network and new people. But the key thing is communication and integration. So um, people work in silos, and what you need is for the team to work together to have a clear objective of what needs to happen. And I haven't resolved that yet. And I think that's because AI is relatively new for the trusts. I think having the expertise and knowledge of what is required. So I do think you need to go through a process first to recognise what the strengths and weaknesses of your organisation are. To then, when you do your second project, you often find that you're able to get to your endpoint quicker because you've established those relationships, the networks, but the same challenges apply. And that's not enough staff within the areas of expertise because they are managing the day-to-day running of the hospital. So asking them to get involved in a new project which they recognise the value and worth of, they just don't have enough hours in the day. I think probably what we'd recognise is that it's the same problems people are facing, particularly within trusts. So the same challenges that you're having in London, you'll be having them in Leeds, you'll have them south of England. And and I just wonder if we need to collaborate better and share good knowledge and expertise, such that when a new trust decides to onboard a new algorithm, they're not having to start from scratch. They can utilise the expertise from elsewhere to be able to do that. I also think it's companies are also accountable. So if they've had particular challenges, how have they overcome those challenges, and how can they help other startups or well-established companies overcome those hurdles? So I think if we can create um, communication across cities, regions, countries, then I think we can help deploy AI much quicker and more efficiently. But also, I think again, it creates a community amongst the clinical team, the IT team, and the wider team to have those discussions, and they become less scared of the new technology. And they also know then if they have a difficulty or a challenge, they can call a friend. And I think that's what we need to do, is build that community of knowledge. I think AI could be widely used within healthcare. I don't think there's a niche area. I actually think it could benefit all different aspects. We look at it from a diagnostic perspective, so aiding diagnosis quicker. Which again is important, because if you can diagnose cancer early or rule out cancer early, that's beneficial for patients in the long term. But also you've got administrative processes, appointments, the way that we follow up patients. I think if we can deploy AI technology in all those aspects, in all those areas, then we could run a more efficient NHS. So I think we have to remember that AI just isn't a diagnostic tool. AI can be used across the whole of medicine, and we need to raise awareness regarding this, and we need companies that think that they can provide solutions for us to come forward, so that we have the ability to choose and decide how we can do things differently. I'm Dr. Nisha Sharma. I'm a consultant breast radiologist and director of the breast screening programme for Leeds and Wakefield. I work at Leeds Teaching Hospital NHS Trust. I have been a director of breast screening since 2008. I have a strong interest in audit and research, and in the more recent years in artificial intelligence. And I'm leading the first trial in AI in breast screening, which will hopefully start in June.